The murmur of mitral stenosis is a low-pitched, rumbling, diastolic murmur heard at the apex, with the patient in the left lateral position. Listen to a patient with mitral stenosis. I will start with 3 normal beats and then add the murmur. The combination of 2-dimensional and 3-dimensional echocardiography can show the stenotic mitral valve in greater detail than ever before possible. This murmur is heard at the cardiac apex with the patient in the left lateral position using the bell of the stethoscope pressed lightly to the chest wall. Two-dimensional echocardiography can show not only the valve area, but also left atrial size and left ventricular function. It can take several years after the initial episode of rheumatic fever before mitral stenosis becomes apparent. With calcific mitral stenosis, the opening snap can be lost, but the murmur remains. A new generation of electronic stethoscopes makes it easier to detect this murmur. In patients with appropriate anatomy, mitral stenosis can be significantly reduced by a balloon valvuloplasty procedure. According to the American College of Cardiology guidelines, patients being considered for balloon mitral valvuloplasty should have a transesophageal echocardiogram to assess the presence of left atrial thrombus and the degree of mitral regurgitation. When a patient's symptoms are discordant with the valve area by echocardiography, then an exercise test can be useful to clarify the significance of the stenosis. The gradient across the stenotic mitral valve becomes larger with exercise. In summary, mitral stenosis presents with a diastolic rumbling murmur, which is heard at the cardiac apex with the bell of the stethoscope and the patient in the left lateral position. Listen once again to a patient with mitral stenosis.